Today's report exposes a closely guarded truth about abortion in Canada. We've been told that late-term abortions beyond 24, 30, and even 36 weeks are rare and only allowed for medical emergencies. But what if that isn't true? What if they're available on request with no medical justification needed? That's exactly what pro-life advocate Alyssa Galobe uncovered and captured on camera.
Upstairs. Hey, I know you're right at our limit. You're very close. You have another week here. Our limit is 24. Canada doesn't have a limit. Okay, our limit is 24. But there's a hospital that sometimes people come here. They're not so sure. They need more time on their house got limits, and they end up deciding, yes, I do want it, but we can't do it anymore. I send them to Women's College Hospital. It's a hospital that's close by. It's 10 minutes from here. They don't have the limit. They sometimes go up to 32, I believe.
Okay. Alyssa joins me to discuss her undercover expose filmed while she herself was pregnant, revealing how providers describe the procedure, the gestational limits, or lack thereof, and the stark, dehumanizing language used for fully developed babies. As executive director of Right Now, a political pro-life group, Alyssa has been advocating for the unborn since age 13, inspired by her own story as the daughter of a teenage pregnancy. She has lobbied at the UN, trained interns, and spoken at schools and universities about the topic, but nothing prepared her for what she heard firsthand in abortion clinics. And she wasn't just an investigator. She was a pregnant woman asking about procedures the public is told never happen.
Yeah, I mean, I'm not going to lie, in these clinic visits, I definitely did get emotional at times, but not for the reasons that they thought. But clearly they're used to women getting emotional because they didn't think twice about it. But it was very traumatizing to a certain degree, because after my very first appointment in the first clinic, just by default, the very next day I had my anatomy scan, my 20-week anatomy scan. So in one day apart, I was going into an abortion clinic where they were doing the ultrasound and wanting to rush me into the clinic to get the abortion. The very next day, the ultrasound tech is showing me very specific details about my baby's anatomy, and we found out that we were having a boy. So that was very stark dichotomy to me when I was doing these undercover exposés. But in Toronto, I want to say that I was surprised, but I'm not. It just still was very shocking to hear. And even for her to just say up until 35 to 36 weeks, it might be impossible to find someone to do it, but she wasn't saying it was impossible. And I mean, I was induced at 37 weeks. So it's just crazy. And I'm sick of the lies that are being told. And I just wanted to prove right from the horse's mouth that that's not actually the facts in Canada.
And do they have, like, sometimes you hear, like, oh, your health has to be in danger. The fetus at, like,
no, that's classic abortion care. That kind of abortion care hasn't been in Canada since like the 1960s.
So they don't ask you anything. You don't have to prove like, oh, I'm at risk or anything like that.
Absolutely not.
No one can possibly say now that they only happen because of serious medical conditions, because I specifically asked if that was the case. I asked the abortionist directly, do I have to prove that I'm at risk or that I have some sort of medical complication to get the late-term abortion? And she said, absolutely not, definitively absolutely not, and that abortion care like that hasn't been around since the 1960s. So not only was she saying that I don't have to do that now, but she's saying you never had to do that. So basically everything that we've been told about third trimester abortions is false. And that's right from someone who's been committing abortions for probably a very long time based on how she was talking about it.
And it wasn't just one provider. Clinic after clinic repeated the same thing. No restrictions, no legal limits, no justification required. Canada stands alone among developed nations in having zero abortion laws, something even the abortion workers themselves freely admit. So how easy exactly is it to get a late-term abortion?
You just call up the clinic, you make an appointment. When you get there, they do an ultrasound. They don't show you the ultrasound, but they need to confirm how far along you are without just your saying so. So they do the ultrasound, and then you go into a quick counseling session. Some were more eager to kind of get you through the process than others. But because I had a lot of questions, usually they brought in the abortionist as well to answer the questions specifically. So it wasn't just the counselor or the nurse. I was hearing it directly from the abortion doctors. So that was really beneficial to kind of hearing what they had to say, how they were saying it. One nurse in one clinic said to me, I know that you're not 100% on this decision, but what do we really know in life 100%? So different things like that were being told to me because I was on the fence about it. I asked a lot about fetal development. One nurse said, there are discernible shapes, and that was at 24 weeks. That was at 6 months of pregnancy. And no one ever used the term baby, or the most they would say is fetus, but even still, if you see the Toronto video, they just call the baby things come out. So very dehumanizing language on purpose, especially for someone who is sitting on the fence. And then if you decide after the counseling session or the question and answer that you want to go through with it, then they would bring you into the medical room and they would insert the laminaria. Then they would send you home. That would take a couple days for your cervix to expand. And then you would come back and get the surgical abortion procedure. I asked at each clinic what happens if the baby or it comes out while I was at home. At one clinic, I was told that you should just throw it in the garbage or flush it down the toilet. This was at 20 weeks. Other people said just call the abortionist and they'll tell you what to do with it. We dispose of it at the clinic. And then in the Toronto video, again, as you can see, she said it's very traumatic and it's a horrible part of the abortion procedure that can happen. So she was very upfront about that it's traumatic, it's horrible, it can happen, but we're still going to do it anyway.
At these stages of pregnancy, the child has fingers, toes, facial expressions, and established pain receptors. Yet clinics dismiss fetal pain, survivability, and consciousness, contradicting themselves within the same breath.
And as far as science knows, there is no consciousness like we have at this point. But if there are words to prevent it, doctor's preference as well.
Right.
And we want you to be post-body, which you are, because 5% of women end up delivering before they come back.
That was particularly amusing to me because on one hand, they were saying the baby isn't conscious, so don't worry about that. And then in the very next sentence, they were saying, but if it was conscious, we kill the baby with digoxin just in case there is consciousness, but there isn't consciousness. So which is it? I was also told that the fetus can't feel pain when there have been numerous reports coming out in recent medical journals stating that the fetus can feel pain up until 12 weeks. So just things that are trying to, reassure you that that the fetus isn't conscious, it can't live outside the womb on its own, despite the fact, again, that the earliest preborn baby was born at 21 weeks. So yes, at each clinic visit, they could survive outside the womb, and that they can't feel pain. So things that are trying to make you feel better about your decision, despite the fact that they're erroneous.
Studies have shown that their actual children thrive better if they feel that way, that they can't handle to have there's also a lot of benefits to society in general. So families tend to be able to have a higher socioeconomic status. Patients can complete their plans, which generally involves education or employment or things like that. The reasons to do it are valid reasons, and everybody will reflect that.
Perhaps most disturbing is how quickly and irreversibly the process begins, leaving no room for second thoughts.
Because, they don't want any born alive babies in between the insertion of the laminaria and the surgical abortion procedure. They inject the fetal heart with digoxin the same day that you get the laminaria inserted. So even if you go home and you change your mind or whatever the case may be, the deed is already done. And I've actually worked with women and know of one specific particular case where a woman did change her mind and then she had to go to the hospital and she gave birth to the baby that had deceased, and she just couldn't wrap her mind around the fact that this was caused by the abortion. She just kept saying, the baby was a stillbirth and kind of tried to wrap her mind around that, which is very disturbing to see because she changed her mind and she had no options then after that because the abortion clinic was so quick to, inject the fetal heart like that. I know that the majority of Canadians are against late-term abortion. Multiple polls have showed this over the years. So despite the fact that, yes, the majority of Canadians do say that they're pro-choice, they also at the same time want restrictions on abortion. We're one of the only countries in the world with no laws on abortion. Again, it's not just me saying that. I was told that repeatedly by the abortion clinic workers that we have no laws in Canada. So that's why it's okay to get these late-term induction abortions. And so I think that because public policy should always reflect public opinion, and this is public opinion. And so it's an obligation, I would imagine, and I would hope, of the legislature, of the federal government to have some sort of regulations and restrictions. And we're told we don't need them because they exist, but this video proves that they don't.
As provinces like Alberta begin to debate policy resolutions on restricting late-term abortions, Golub's work becomes even more vital. Her investigation joins a long tradition of undercover reporting, including by mainstream media outlets, that exposes practices the public is not supposed to see.
The law in Canada and the US overall doesn't have it too far. Okay. I can tell you that once things reach 35, 36 weeks, it might be impossible to find someone that would do it. Okay. 24 up to 30 weeks, it's very possible. The system certainly doesn't think it's too far. Okay.
Undercover investigations like this are relatively common. For example, the whole reason why we knew that gender selection abortions were happening is because the CBC went undercover in ultrasound clinics and recorded and released those secret recordings of the ultrasound techs, encouraging or asking if they wanted to terminate based on the gender of the pregnancy. So my investigation is basically an extension of that to show that, that these atrocities are happening. We're not being told the truth. And so kind of what does the public have to say about that?
If you'd like to support our journalism and sport some swag out in the wild, you can do so by visiting our online store at rebelnewsstore.com. Check out all of our merch there, and if you'd like, you can save 10% off your total order by using code TAMARA10, that's TAMARA 10, to save 10%. All of that at rebelnewsstore.com and use code TAMARA10 at checkout.